Okay. Great. So welcome everybody to this evening's session, Learn with CSH, the Centre for Sustainable Healthcare. So this evening we are presenting our educational offerings. This event was actually recommended by one of our network members because they were saying that actually CSH has sort of so many resources available. There's so many courses out there. It would be really good to have a bit of a summary of what's available, and so that we can present that to everybody so people can be making the most use of what we have available. So we're really happy to be here tonight to share that with you. My name is Nuala Hampson. I'm a pharmacist by background. I am associate with CSH and I'm pharmacy lead for CSH. And I'll be introducing my colleagues as we sort of move over to their parts of the presentation. They'll introduce themselves as they go along. So I'm going to hand over to Steffi.
Hello everyone, I'm Steffi Barna. I have a background in public health and teaching in undergraduate medicine, nursing and allied health professions. And we're really happy to be with you today. We've got nearly 15 years of experience in education, and really our focus is to inspire people to develop new knowledge about the world, empower people with the skills to do something, and eventually in the next 5 years, transform the health system into a sustainable one. So as some of you know, we've developed these principles of sustainable clinical practice. So if we say, what is sustainable healthcare, we tend to look at the actions for system transformation in 4 areas. So I'll start with number 4, because the thing we usually think about is, how can we make the thing that we're doing lower carbon? And there's ways that you can swap systems to have less greenhouse gas emissions from what you're doing. But actually, equally importantly is number 3, having a leaner way that you provide healthcare, so streamlining to eliminate waste. Equally important is empowering patients to take care of themselves, take a greater role in their care, and collaborate with healthcare providers in their care. But by far the most powerful is, of course, if we could prevent people from falling ill with preventable illnesses, they wouldn't come into the health system, they wouldn't need high carbon healthcare. So for many of us, we forget about prevention or secondary prevention or tertiary prevention as part of the clinical work we do, or when we teach about clinical healthcare. So CSH has a range of programs, and if I start again on the right, many of us have developed specialties that are looking at how to make nephrology more sustainable, maternal health care more sustainable, anesthetics more sustainable. We've done a huge amount of education and training. In fact, most of our programs have a training component to them. The nicest thing we do is working on green space for health and the NHS forest, where we don't have to talk directly about carbon, but you'll hear more about that. We do carbon footprinting and impact analyses. We have a marvelous program called the Green Team Competition, where different wards or different national groups will come up with ideas to improve the sustainability and the triple bottom line of their practice. And they will then present those ideas, which are then judged, awarded, and usually rolled out in the hospital that they're in. And as many of you will know, thinking about quality improvement as a triple bottom line, so thinking about environmental cost, financial cost, and social benefit or harm of what we do as we're helping patients get healthier. So those are our main areas of work, and all of them have education components. So we've designed a number of things that would help educators or people working in clinics. We have free e-learning modules on e-learning for healthcare. We run short courses which are mentored. We have the Green Team Competition I've mentioned, and the Academy for Quality Improvement. We have occasionally funded fellows and scholars who work on sustainability in a particular specialty. For boards, we do a short workshop on what they need to do to get on top of ambitious green plans. We do carbon footprinting and help develop carbon literacy. The NHS Forest I'll mention, and we'll talk about shortly. Nuala has mentioned the networks, the peer networks in various specialties where you can meet people from around the world who are interested in your field. and we help people develop strategic plans like green plans.
Great, thanks, Steffi. I'm going to hand it over to Dan now. Tell us about the NHS Forest.
Thanks, Nuala. So yes, I'm Dan Lovard, the Green Space for Health Project Manager at the Centre for Sustainable Healthcare. So yeah, this slide is just giving you a bit of a flavour of what we do within the Green Space team. So hopefully some of you may be aware of the NHS Forest, but it's our flagship Green Space programme with a variety of different projects, which you can see listed on the slide. So I won't have time to go through all of them, but it's just giving you a flavour of the variety that we offer. So there's research and policy, and also, I suppose in summary, we work closely with estates and sustainability teams to integrate nature into healthcare settings, whether that's on their estate or ways that we can integrate it within patient care pathways and to improve staff wellbeing as well. So one of our sort of core offers is around tree planting. So since 2009, when the NHS Forest started, we've planted an impressive 140,000 trees and got them in the ground within the healthcare estate. So that's one of our core offers, which we continue to provide for healthcare teams. And then something that I'll touch on as well is the sustainability network, which is specifically around green space for health, a space for people that are like-minded and want to find out more about ways that they can be inspired and connect with others with developing green space projects. And then also I'll just quickly note around the Nature for Health Resource Hub, which is a great central repository for healthcare staff to access a variety of different practical tools to develop green space projects that have been developed by a lot of different organisations. So all relevant stuff that hopefully will inform and inspire you. So I'll leave it at that because otherwise it could go on for a long time, but that's a bit of a flavour. So yeah, go on our NHS Forest website and you can find out more.
Great, thank you, Dan. So hopefully you can see from that brief introduction that CSH covers a sort of a whole breadth of clinical and non-clinical areas. So hopefully sort of something for everybody who's coming along this evening. As the focus of this evening's presentation is around education, and we know we're expecting there's quite a few educators and students as well as health professionals in the audience, we wanted to look at sort of, I guess, what the levers are around embedding education for sustainable healthcare into your curricula or into your post-qualification training. And this is variable across the professions. So this is just kind of a quick summary of some of the key sort of documents and frameworks in the UK that might be relevant to you. So for medicines, obviously there's a GMC outcomes for graduates, which requires graduates to be aware of sustainable healthcare and how to apply it in their practice. Sustainability is mentioned briefly in the GMC Good Medical Practice, and the Medical Schools Council have approved an education for sustainable healthcare curriculum. So for those of you working in education in med schools, there is actually a curriculum already out there available which you can take and adapt to your own medical school. And we will be linking to all of these resources within the networks at the end of the session. I'm just going to hand over to Anna, who's going to talk you through nursing and midwifery.
Hello everyone, my name's Anna. I am by background a paediatric nurse, worked in NICU, and I have some further education in public health. For nursing and midwifery, we have in the standards of proficiency for midwives a very, very clear commitment to sustainable healthcare. They say that demonstrating knowledge and understanding of the principles and methods of sustainable healthcare is a core part of being a midwife. For the nurses, the NMC code, this one's currently undergoing code review, and we're having high hopes that it will include sustainable healthcare as well. It currently does not specifically include it, but the NMC has in 2024 shown that they are very interested in sustainability in healthcare and in nursing when they publish their environmental sustainability plan. Back to you, Mila.
Thanks, Anna. So for pharmacy, at the moment, there isn't a requirement for education for sustainable healthcare within the pharmacy undergraduate curriculum, but it is coming in the next review. So the GPHC, which is the General Pharmaceutical Council, a regulatory body, has last year published its Net Zero Action Plan, and it is very clear from that action plan that the GPHC plans to embed sustainability across its regulatory framework, from undergraduate curricula right through to fitness to practice and sort of post-qualification pharmacy standards. So there is a group in the UK and Ireland, the Sustainability and Pharmacy Education Group, who is currently working towards developing materials for the pharmacy undergraduate curriculum and embedding them across those schools in the UK and Ireland. So a really active group there, which is really great. Pharmacy Schools Council has also approved a set of learning outcomes, again created by that aforementioned group, and what they've done is looked at the GPHC learning outcomes and mapped sustainability to them. So all of that information is on the Pharmacy Declares website. So if you're working in a school of pharmacy or you're educating pharmacy technicians, that's the place to go to sort of find the detail behind those resources. And then for allied health professionals, the Council of Deans of Health have also published a curricula for allied health professionals. So again, there is a curriculum there sort of ready to be used and adapted if you are teaching that group of health professionals. So it's really good to see these sort of regulatory requirements coming through, because it means then that we as educators, have to start ensuring that we are embedding this education into sustainable healthcare, so that our health professionals of the future are prepared for the changing environment in healthcare which they are going to be facing. So another few resources here, Education for Sustainable Development. This document was released over 10 years ago by the Quality Assurance Agency and the Higher Education Authority, sort of defining education for sustainable development. And many higher education institutes across the UK have taken this up as a requirement and are requiring across their universities that their lecturers teach education for sustainable development. So this is based on the UN 17 Sustainable Development Goals. So you might be familiar with these from within your institutions. So again, sort of 17 goals that were set by the UN for a cleaner, brighter, greener, fairer world. And the aim is to achieve those by 2030. So quite a significant amount of work still to be done. But if you sort of go to the UN website and look at those in a little bit more detail, you'll see that one of them is around climate action, but actually they're all interrelated, looking at things like access to healthy food, clean air, life below the water, everything sort of interconnected. So a good thing to sort of hang your education development on. The AMY consensus statement has also produced 3 learning outcomes for embedding education for sustainable healthcare. AMY is the Association of Medical Education in Europe. So again, that gives you a really good starting point if you're thinking about bringing sustainable healthcare into your curriculum or into your education. That document provides a really good starting point to start working from. Back to you, Steffi. Oh, you're muted, Steffi.
We've had funding from a number of different groups to develop free taster modules in various fields. So the first thing we had done together with Greener NHS was introducing people to the idea of why we need a net zero plan for the NHS. And it's a very light touch, cartoony, animated film kind of learning opportunity. And then since then, we've developed how to teach, what is SUSQI and materials that people can use for teaching. Dentistry has funded a taster module, endoscopists have, and operating theatres have. So anybody with an email ID from the UK can access that for free. And you can see, I think if you just carry on with the slides, there's a, it's a very lively, it's not your typical e-learning for healthcare PowerPoint set that you click through. There's lively stories and case studies and characters. And it's structured in a very simple way. So what's the overview between healthcare and environment? What's happening in the particular field that that taster module addresses, and what you can do, very specific in your role, actual ideas that you can get started. So half an hour, you could give this to students to give them some background. You can give it to colleagues to show them what you're interested in.
Great, thank you, Steffi. This piece of work, and this is one of our web pages on our CSH website, is around a project that we did last year on medicines waste in care homes. So what we did is we wanted to explore the very well reported issue of medicines waste in care homes, but to look at it from a slightly different perspective in terms of looking at it through that environmental lens. So we were exploring the environmental, social and financial impacts of medicines waste in care homes. The whole report is available on the website. There's also a short 15-minute video, education video, which is freely available on the website. So if you are either working in or training people who are working in the medicines pathway in care homes, and that's care home staff, it's community pharmacy staff, it's GP practice staff, then that 15-minute video is a really good introduction to the issue of medicines waste, which is actually very invisible to most people, and the kind of the environmental impacts of that medicines waste and the financial impacts of medicines waste, and more importantly, what to do about it. So some of the key recommendations from that project was that actually there needs to be more training for staff across that pathway, which is why we've created the video. We need to kind of increase the visibility of the medicines waste and the accountability around medicines waste, and that communication across those sites is really important so that staff at all of those sites sort of understand the processes and how they work and what they can do to optimize those. So a couple of QR codes there. There's the CSH project page where you will find the detailed report on the project and some presentations on the project, and also that free education screencast that I've mentioned that you can access and share with your students or fellow health professionals if you are working in that setting. And also there a link to the pharmacy network, where most of the information relating to this and the projects, the sort of the small QI projects within this study, are hosted on the pharmacy network. So lots of information there if medicines waste is something that's of interest to you. Steffi.
Yeah, many of you know that we've been running courses for about 5 years, and these are sort of hybrid. Half of it is an online textbook, which has everything you would want to know about the specialty that you're interested in. And then half the day we spend in a workshop talking through projects that you might want to do and mentoring you with them. So you can see there's a huge range of topics, and the new thing that we've been asked to do by some academics is to allow a group of people. So if you're in a, let's say, a medical faculty and you're a nephrologist and you're a respiratory person, your primary care, all want to do a course, they can do that course together, and then you can have a workshop as a group and focus on how to implement the learning from these courses into the teaching that you're already doing. So if anyone's interested in that, we haven't yet set up the sign up, but if you write to me directly or pop your name in the chat, I can write to you in a week or two when that's ready. So that would be a faculty development package in sustainable healthcare with different faculty members attending different courses and coming together for a workshop to do curriculum planning.
Thanks, Steffi. And I'm going to hand over to Anna now.
Thank you. So I'm going to tell you a little bit about our work with education for nurses and midwives. So this is either for you if you're a nurse or midwife, or if you in some way or capacity work with nurses and midwives, which I assume most of us do if we work in healthcare. The Future of Health is the Future of Health and Social Care project is funded by the Burdett Trust for Nursing and run by us at the Centre for Sustainable Healthcare. I think I can navigate forward myself. Thank you. The courses are available for any registered nurse or midwife worldwide, so it doesn't matter where you are in the world, you can attend the courses. They're fully funded for registered nurses and midwives, which doesn't mean they're entirely free. They're just free for you at the end, but the Burdett Trust pays for your fees. You can book your space for the courses online on our website. They're fully virtual, and you can also book for a group in your organization by contacting us directly. And the courses don't end when the last webinar is over, but you can become a part of the community of practice and have ongoing support. We've got 3 different courses for different audience. The first one is Sustainable Innovation for Nurses and Midwives. This one is developed for frontline nurses and midwives, but nursing and midwifery students can attend too if they would like to. And even if you're not a frontline nurse,
Has Anna frozen for everybody else?
oh, can you still hear me?
Okay, I think you just froze for a second. We can hear you again, Anna.
Okay. So what I was saying is that this course is not just for frontline nurses and midwives, but anyone who wants to learn the basics of sustainable healthcare and get support with finding the right project for their everyday work. The second course is Sustainability Analysis in QI Nursing and Midwifery. This one has been developed for specialist service leads and team leads. But again, it is also open to anyone wanting to apply SUSQI methodology to a project idea that they already have. And it's a good build on to the first course. The third course, the Sustainable Innovation Leadership for Senior Nurses and Midwives, is a little bit different. It is less focused on helping you build a project and more focused on helping you find the network that you need. And this one is for board and executive level senior colleagues, senior nurses and midwives. And here the applications are checked in detail and to make sure that everybody has the right level to attend the courses. The first course, Sustainable Innovation for Nurses and Midwives, has 3 different parts. It consists of a self-study online with 8 hours of pre-webinar learning, plus a lot of optional learning as well, and live webinar of 2 hours. And then we invite you to come to our Sustainable Healthcare Cafes, which we do on a regular basis. Any alumni of the course can join as often as they want to get ongoing support. You will get out of this a project plan and your reflective practice journal that you can use for NMC revalidation. The second course, Sustainability Analysis in QI Nursing and Midwifery, is also in 3 parts. Just like the first course, it's in total 10 hours of learning, just that here it's 6 hours of pre-workshop learning and 4 hours of workshop. But you can also see the optional learning materials of the first course, as well as some more materials on carbon footprinting. Similar to the first course, we have work in progress meetings that we hold regularly, where you can just drop in and ask questions and we help you with your ongoing project. Like the first course, you get a project plan out of it and a reflective practice journal for your revalidation. Finally, the last course, Sustainable Innovation Leadership for Senior Nurses and Midwives, is has a little bit of a different focus where the result is mostly networking. The first part is some pre-course briefing that you get sent by email, but you also have access to the online learning platform where you can do optionally more learning. One live workshop online with our fairly senior facilitators as well. And after the workshop, there's an optional follow-up session, one of them 3 months after the course. This course is based around, well, it's discussion-based and it's based around leading yourself, leading others, and leading systems towards a sustainability transformation. And I think this is to Dan.
Yeah, thanks, Dan.
Great, thank you. Yes, so yeah, this is a Nature and Healthcare module that we offer, which is a free introductory module acting as a stepping stone, exploring the connection between nature, human health, and the healthcare sector, and leads on nicely to our Green Space for Health course, which I'll touch on in the next slide. But yeah, this short module explores how explores our reliance on nature and its ongoing decline, unfortunately, and its direct impact on health outcomes and health inequalities as well. So we introduced the idea of a nature footprint, helping healthcare teams understand the impact the sector has on the natural world and why healthcare has a crucial role to play in nature's recovery as well. So it's a simple practical framework where there's 3 points around reducing our footprint, restoring nature, and rebuilding people's connection to nature as well. And next slide, please. Yeah. Great, thank you. So the Green Space for Health course is a more in-depth training that we offer and follows a similar setup to what Steffi was mentioning earlier, where there's an interactive part and the learning through the online platform. So this focuses more in depth on the connection between human health and environmental health and the climate crisis as well. And draws on a lot of international evidence showcasing this and supporting this, and we bring this to life through real life examples through a variety of different case studies and stories to help further showcase the impact and provide inspiration as well for people that are learning. And a key focus is around leadership capability. So staff, a core focus of the course is to provide that confidence with maximising the green space opportunities that they can have on their sites. And then there's that workshop element as well, where it gives participants the opportunity to bring their own green space project to the course, where others that have taken part within that cohort and also the Green Space team will work through some challenges, discuss in more depth about the Green Space projects in mind, work as closely as possible in that setting and through the sustainability cafes as well, and through the Green Space for Health network to make those aspirations become a reality, basically. Yeah. And then the next one is on the 20th of May, which you would have seen on the slide. So if you're interested, do sign up.
Thanks, Dan. I don't think Ioma has been able to join us. I can't see her in the participant list. So Steffi, can you talk us through SUSQI resources? You're muted.
One of the really exciting concepts that CSH developed is thinking about quality improvement as a tool for not only sustainability, but inequalities. So what we know is that many clinicians are not that interested in quality improvement. Cost saving is not their primary motive. And so having idea of what is value in the health system that has a triple bottom line, that there's a financial cost, there's an environmental cost, and there's a social harm or maybe benefit to what we do with patients to get them healthy. So that's called this triple bottom line in business, and in healthcare, the triple bottom line is really good at looking for really creative ways to improve patient outcomes while reducing the environmental pollution, reducing social harms, and maybe increasing social benefits, and trying to control costs. And there's lots of ways to do that. So we've got an academy where people can join and train in it. We're working with many, many hospitals with their quality improvement teams. This has been really effective in the UK. There's a lot of free materials. You'll see there's a website that has all the information about how to train yourself and how you can train other people. If you don't like self-study, come to one of our courses that have this mentored workshop where you really get ideas about how you could either run quality improvement with a triple bottom line sustainably or teach it. And there's a lot of terrific teaching materials on the SUSQI website also. So if you're at all involved with research or quality or audits, if you're teaching audits, that's a really good tool and it's been very well worked out.
Thanks, Steffi. And I'm handing over to Ollie now.
Hey everyone, I'm Ollie. I look after all of our networks here at CSH. So we have an online platform which hosts over 30 specialty and discipline specific networks. You can see a selection of these on the screen here, but we have a really big range with everything from dermatology to arts, drama and music therapies. So if you're working clinically, if you're working in research, or if you're a patient representative, our networks really welcome you. They're an excellent resource. They host lots of resources, so anyone who's part of the network's community can upload and share resources, whether that's case studies, academic articles, blog posts, all things like that can be shared there. And there is a section for sharing topics. So if you have a question, want some advice, generally want to chat about something that you're working on, you can post it there and people will weigh in. And it's a great place to form a community of practice around sustainability in your work. And a lot of CSH's outputs from our ongoing projects are also shared there. So it's a great way to stay up to date with our work and hear about what we're doing. So we'll be sharing a resource list after this. So if you've missed any of the QR codes, don't worry, we will be sharing those with you, including a link to join the networks. And I think now we're moving on to a chance for any questions and discussion. So I'll hand back over to Steffi and Nuala for this part.
Okay, so thank you very much, everybody, for coming along. And we're going to take some time for discussion.